This segment of DelmarvaLife is sponsored by TidalHealth.
For those experiencing traumatic situations, it is important to have a safe and inviting resource. Now, that could include mental health emergencies or behavioral health crisis respite, or everything in between.
Which is why TidalHealth's Crisis Center is standing by 7 days a week to be able to render that critical aid to those who need it most. And we're here today with Dr. Catherine Fiddler, the Vice President of Population Health with TidalHealth. Welcome to DelmarvaLife. Thank you for being here.
Thanks so much.
First of all, what is the Crisis Center and how does it support behavioral health?
So the Crisis Center is an integral part of our behavioral health service line, and really what it is, it's not dissimilar from urgent care in the community that people seek for medical needs. It's really a place where, as you mentioned, if something traumatic is going on and you need someone to talk to, you can go there for that. But also if you're following up with a psychiatrist or a therapist and you're not able to get in with them, we have therapists and psychiatrists there during the office hours. So it's open 8 to 8, 7 days a week. And it's a beautiful place. It has nurses, it has technicians, it has our social workers and either a nurse practitioner or a psychiatrist there to treat people and meet them kind of where they're at.
Mm-hmm.
It sounds like you have a plethora of services to offer.
It is. It's a beautiful resource, and it is in conjunction with Atlantic General Hospital and Chesapeake Health Services. Mm-hmm. So down in Berlin, they have a similar model, open Monday through Friday from 8 to 6, so a bit shortened hours, but it's the same type of service, the ability to walk in and get care when you might need it.
So how does the Crisis Center support workplaces and their employees?
So that's probably one of the most under-leveraged things that we have at the Crisis Center. So oftentimes employees experience something at work, whether it's something in their family and they bring that trauma or that problem to the workplace, or they're just very upset about something and need additional support. I know for healthcare workers, for law enforcement, for many people, we have a lot of opportunity to see trauma live in our workplace. But those folks can often just go in there, walk in, 8 to 8 it's open, and be able to sit in a quiet, calming environment and then speak to a therapist. As I said, they can really talk to somebody. We also find people get discharged from the hospital, discharged from other behavioral health services. They're done with them, but then they find that they really need to reconnect. It's not always, you can't just call up a doctor often today and find an appointment with a psychiatrist or a therapist. So you can walk in there and we can be that bridge to care as well.
So when it comes to urgent care, mm-hmm. It is available.
It's there.
I need help now.
And that's what you can do. And we use it for our own employees at TidalHealth. We definitely refer folks over there. You know, oftentimes, as I said before, with law enforcement, with many of the careers that we have in the community, we do experience something that really jars us in some way, and we just need someone to talk to. Maybe not long-term therapy, maybe so, but regardless, you have that trusted care provider there, and it's beautiful. If you haven't seen it, it's an absolutely beautiful place. We encourage people to come over and just kind of check it out.
Just look.
So someone walks in, having a situation, does the staff there coordinate with our regular doctors?
Absolutely. So this really it's a bridge to care. So we know, first of all, when anyone comes in, they're going to be screened for safety, because that's what we always are concerned about with behavioral health crises, is we want to make sure the individual's safe. But then, yes, there is a registered nurse there who can work to help connect the dots to care. Oftentimes we know people traveling, maybe you just ran out of medicines and were unable to see your physician, your psychiatrist. You can come there and talk to them and see what's going on. We can connect with that psychiatrist out of town and perhaps get you a refill on medication if that's something that is really required, or just some time with a therapist. So people traveling, any workplaces who have any sort of trauma or anything that they're experiencing that they really just need additional support. Or, we can work with kids. There's no age limit.
I was going to ask you about kids. I mean, what? So you've got something for the kids?
We do.
Well.
So on the outpatient side, we have behavioral health services for children and adolescents, but these folks can come, kids and their parents can also come here as well.
Because how many times does that happen? You got a kid.
Yes.
I need some help handling this.
Right,
yeah.
right. Dr. Catherine Fiddler with TidalHealth, thank you so much.
Thank you.
Absolutely.
For coming in this afternoon.